Welcome to ABC Behavior Training, where we're disseminating the science of ABA to everyday behavior analysts through resources, education, and supervision. Be sure to subscribe to our newsletter at abcbehaviortx.com. Hey guys, thank you so much for joining Behavior Crew's live podcast tonight. If you are joining me live or watching this on Facebook as a replay or on YouTube, you may notice that I do not have my camera up tonight. Unfortunately, having some technical camera issues, but I am still here coming to you with some great information related to ABA. So, regardless of where you're listening to me, whether it's live or on replay, if you're listening on Spotify, Apple Podcasts, Amazon Music, wherever it is that you listen to your favorite podcasts, you can get CEUs for tonight's discussion. So, make sure that you're paying attention. Go to my website so you can get that. Now, if you are a pro level member of the Behavior Crew, you are going to get all of these CEUs for free. So that's all of the podcasts that I do, plus tons of resources, live webinar CEUs, newsletters that come out on a regular basis, therapy materials, and more. Just a ton of stuff. So even if you are a free member, you do get the first podcast every month for free. So that's going to be like half of a CEU that you can get. But again, if you're a pro level member, you'll be getting, up to 4 to 5 CEUs that you can access every month for free with the current month topic and also the previous month's topic. So every month we will be covering a new topic related to the field of ABA, and this month's topic we are talking about antecedent interventions. This month we've already talked about non-contingent reinforcement on our last podcast, how to reduce CMORs in our monthly webinar. So that's going to relate to reducing those escape maintained behaviors in your sessions. And pro level members will have also received a full antecedent interventions procedures guide, which you can access in your monthly module. So today we're going to continue this talk of antecedent interventions by talking about graduated exposure and desensitization. So a lot of times these two interventions are used interchangeably. So we say graduated exposure, we also say desensitization, like they're the same thing, and they're very similar, but they do have some slight differences. Now, both interventions are used to decrease the response to stimuli that evoke challenging or unwanted behavior. Now, in our therapy sessions, of course, we're talking about challenging or problem behavior. Now, when I say unwanted behavior, not typically a term that we use when we're talking about our clients' behavior because they obviously are getting reinforced for it. They want to engage in that behavior. But when I'm saying unwanted behavior, it's because it's not just for use in ABA therapy with children with autism. So, graduated exposure, desensitization, this can be used with anyone. So, anyone with phobias or irrational fears, OCD like behaviors, social anxiety, or even just regular anxiety, traumatic triggers, and more. So, this is an intervention that is really just beyond working with kids with autism. So, that's really cool. It's something that you can use with yourself. As me personally, somebody that has dealt with anxiety on and off throughout my life, I have actually used this with me as well, just decreasing those responses and that anxiety that you have in certain situations. So really it is across the board, not just specific to kids with autism. So the intervention starts by creating a hierarchy of stimulus that evoke these behaviors. So these, whatever these responses are that we're trying to decrease, that evoke these behaviors from least to most likely to affect the client. Then you're going to systematically and gradually introduce the stimulus from that least to most. So the desensitization aspect adds a relaxation component to the graduated exposure procedure. So they are both the same procedure, but when we're talking about desensitization, that's where we're adding that relaxation to it. So we'll talk about some, therapy specific implementation to this, but let's just to kind of go over it really generally, talking about what that hierarchy might look like. Let's say that you are afraid of spiders, right? Spiders are great. You shouldn't be afraid of them, but maybe they freak you out a bit. So you have this irrational fear to spiders. You see a spider and maybe you jump on a chair or run in the other direction or just have your heart racing and it's really uncomfortable. So, to start out with, we're not going to sit you next to a spider and ask you to hold it. Maybe you would start with looking at a picture of a spider, then maybe looking at a video of a spider because that's going to be more realistic, moving close up than just looking at a picture. Then maybe you might have a spider in a room, but you know it's there, but you can't see it, and it's on the other side of the room. Then maybe you can see it. It's in like a glass container with no cover. No cover as in like it's still contained, but it's not like covered with a blanket or something. And then you're going to move the spider in this container closer and closer and closer to you until ultimately the spider can be next to you. The spider can be out of the container, hanging out on a table. Maybe if you're getting really brave, you might want to hold the spider. But we want it to be functional. Most people aren't going to be holding spiders, so that might be a step that you don't actually need to go that far. But if you can exist in the same room within a few feet of a spider, then that would be functional because that's what you're going to encounter in real life. I've even used this procedure actually exactly like what I described there with mosquito hawks. I'm in Texas, so we call those things that look like flying daddy long legs mosquito hawks here. Their technical name, I think they're called crane flies, but they look like daddy long legs with wings that just fly aimlessly everywhere in the summer. So I had a client that was really afraid of them, which was a problem because they're everywhere outside. So you go out on the playground, you go outside to your car and there's these mosquito hawks just, flying around, very very bad flying skills that they have. So that's what we did. We looked at pictures, then we looked at videos. I caught mosquito hawks, put it in a clear container, got it closer and closer and closer to him. And honestly, by the end of this, which with him, it took like less than a week to get to this point. He was catching mosquito hawks, putting it in his, little container that we had kept some of those mosquito hawks in, and he was naming them, and they were his buddies, calling them his friends, carrying them around the clinic. So it really did go pretty quickly from this very exaggerated the fear response to going through this graduated exposure, and he was suddenly best friends with all the mosquito hawks. So, a really, really good procedure for something like that. Now, just kind of going a little bit more in depth and going back just to the procedure itself, this process works by habituation. So, key term you should remember from school. But habituation, that's basically where the client or yourself or whoever is being exposed to this stimuli, which was aversive or startling or whatever it was in small increments over and over again. So habituation by itself, it doesn't have to be in small increments. It's just you're exposed to it repeatedly. But of course, with this, we don't want to make it traumatic. So starting small and then increasing it over time. But by encountering this stimuli over and over and over again, you become used to it. And eventually, it no longer evokes the same response that it once did. So you used to have this fear response to spiders, but you have been exposed to it so many times and slowly, so that your anxiety doesn't go from like a 0 to a 10 all at once. It's a slow progression. You do become used to it through this process of habituation. So, systematic desensitization, this was developed in the late 1950s by Joseph Walp, and hopefully I'm saying that name correct. But he started it while working with veterans suffering from PTSD from World War II. So he used Pavlov's research on classical conditioning that we should all be familiar with to create a counter conditioning procedure where the clients that he was working with were gradually exposed to aversive stimuli that prevented them from re-entering civilian life, as many of the sounds, smells, and other environmental stimuli were associated with these traumatic experiences that they encountered in war. So, by including this relaxation component, he found that the patients could not feel afraid and relaxed at the same time. So that's kind of where this came into play of including this relaxation along with this graduated exposure to these aversive events. Now, there's a lot of different potential methods that you could use for relaxation exercise, but three commonly used ones are progressive muscle relaxation, guided visualization, and deep breathing. So, that first one, progressive muscle relaxation, that works by having the client tense and relax small muscle groups of their body from their toes to their head, or honestly, in any other order you want. So you might start by prompting them to, okay, clench your toes and then relax, clench your toes and then relax. Okay, let's do it to the arch of your foot, then calves going up to your thighs, and so forth. So using this, tightening, tensing, and relaxation, along with some deep breathing, and that can be one relaxation exercise to use. Guided visualization is another one, and that's going to prompt the client to use all of their senses to visualize a calm place, focusing on what they see, smell, feel, taste, and hear. And then deep breathing, oftentimes you might do that in counts of three. So take a breath in for three, hold your breath for 3 seconds, release for 3 seconds, hold your breath for 3 seconds, and then continuing on with that. Also called box breathing, but where you're doing that breathing and holding in between breaths all for the same amount of time. Or also focusing on the rise and fall of their belly when they're taking those breaths, so they're not just having those shallow breaths from their chest, but taking full inhalations and exhalations and focusing on that can also prompt relaxation. So, doing those things while they are exposed to this aversive stimulus, that's going to decrease that fear or that anxiety response that they may be having. Because, again, relaxing is going to not be something you can do while you are having this fear response. So it stops that and replaces it with something that's more beneficial. So there are so many ways these antecedent interventions can be used in a therapy setting and also in real life. In ABA therapy, in addition to the example we went over, we can see this being used for social anxiety or avoidance, increasing medical compliance with, going to the doctor, getting physical exams, going to the dentist, decreasing picky eating, decreasing OCD or repetitive behaviors, and more. So there are two articles that I want to go over that talks about this use of graduated exposure in an ABA setting. Before I jump into these articles, do you work with clients with challenging behaviors? Let's be honest, challenging behaviors can be, well, challenging. Maybe you're having trouble coming up with the best intervention strategy, or maybe you might know the procedures you should be using, but they aren't working. I can help with that. If you want an in depth look at decreasing behaviors, sign up for my masterclass, Behavioral Interventions for Challenging Behaviors. We'll look at antecedent interventions, consequence interventions, how to troubleshoot when your interventions are not working, goal writing, and more. Plus, like all of my masterclass courses, it will come with resources to help you implement the strategies you learn right away. The link to sign up will be in the description below. Hit pause, click on that link, and sign up now before you forget. Now, let's take a look at these two articles. The first one I want to talk about is using graduated exposure and differential reinforcement to increase food repertoire in a child with autism. So, this article was published in 2015 by the Journal of Behavior Analysis Practice with the authors Amy Tanner and Bianca Andrione. Their participant was a 3.5-year-old boy with autism. He was verbal and generally compliant with his ABA sessions, and he had feeding sessions for about 20 minutes a day before his snack time. So at baseline, they would present him with the target food and prompt him that he could eat if he wanted to. Then they would take data on which level of the predetermined hierarchy he engaged in. During the intervention, they would present the client with the food in bite-sized pieces, then would lead him through the hierarchy by modeling each step. So, this hierarchy that they did for the feeding therapy, it was a 12-step hierarchy starting from the least to the most likely to cause the client to engage in noncompliance or challenging behavior. So, this hierarchy, it started with just tolerating the food in the therapy room. Then it would move on to tolerating the food on the therapy table, followed by tolerating the food within 1 foot. Then the next steps involved engaging with the food. So the fourth step was to touch the food and throw it away, then to smell the food and throw it away, then to kiss the food and throw it away, so to put it to his lips. Then he would work on licking the food and throwing it away, followed by licking the food 5 times and then throwing it away. The ninth step was to break the food with his teeth and throw it away, followed by chewing the food 5 times and then throwing it away. Step number 11 was eating a small piece of the food, and then step 12 was eating an entire piece of the food. And then it would move on to generalization, where he would have to eat larger portions of the food in just his natural environment. So once he completed one of these steps, whatever it was that he was to do with that bite, he would earn tokens. And after 5 tokens, he could have a break from the table and access to a preferred item. At the completion of the whole feeding session, he could earn preferred social reinforcement to engage with his peers. But if the client refused to complete the step, or if he gagged, the target would move back 2 levels in the hierarchy, and they would begin that level again. So this procedure lasted for over 100 sessions, which was over 9 months, in which the client increased their food acceptance from 4 foods to over 50 foods. That is a huge increase. And with that, 27 of those foods generalized to his natural environment, so he was eating them on a more regular basis with other people and in different settings, not just in that therapy setting. And with each set of targets, because they would do sets of 4 food at a time, he was able to increase his rate of food acceptance faster than the previous set. So with that first set of foods that they worked on, it took him about 28 days before he would move to food acceptance, to where he was actually, going through and completing all those steps. And eventually it moved to an average rate of 3.75 sessions. So 28 days to just under 4 sessions to food acceptance. So it started getting a lot faster. Even though it was new foods that he wasn't working on previously, it was the same procedure. So he was able to go through it faster than just when he started at the beginning. So this was super successful, and graduated exposure plays a huge part in reducing picky eating in children with autism. This is just like a must do if you are working on feeding therapy or reducing this picky eating. So, a popular method for reducing this food selectivity, often used by speech therapists or occupational therapists, uh, actually focuses on really just those first steps of interacting with the food, playing with the food, touching the food, maybe some of it gets in their mouth. But without this systematic way of moving through these steps and moving forward and backwards, a lot of research has shown that it is drastically less effective than utilizing graduated exposure in an ABA setting. So when we have this very systematic way that we are moving a client through these steps, that is very, very effective for us to do that. And when you don't really have that systematic, desensitization that you're working on, the results are unfortunately a lot less than if you are using this. So I will definitely be doing a masterclass on feeding therapy in the coming months. It is the month of June right now, but I would say probably in the fall of 2023 this year, I'll be having a masterclass on feeding therapy because that is something that I was trained in just before I was even a BCBA at the very beginning of my experience of utilizing this to reduce picky eating and also more severe food selectivity. So, if you are interested in feeding therapy and how we use this in a much more in depth course, be sure to be on the lookout on that. And if you check out this article is definitely good at discussing the merits of graduated exposure for feeding therapy, but there are a few things that you will not see me utilize in my masterclass when I talk about it, or actually probably will tell you not to do these things. One of the things that they did in this article was prompting the client, which food do you want to play with? Well, we don't play with food, we eat food, even if he is just touching it or kissing it and then putting it in the trash. You don't really want to set up that you're playing with food contingency there. And they also reinforce bites or him doing those steps with tokens, which you might need to do that if you have a client that really has no preferred food, but it's really best to make it like more naturalistic in that, you typically have a plate of food with different things, some that you like, some that you don't really like. So if you're ever able to provide reinforcement in feeding therapy and provide that reinforcement of them engaging with this non-preferred food and reinforcing it with a preferred food, even if it's like a snack or a chip or something like that, that's much more ideal than using something completely non-food related. But even still, even with those things, this article was super successful in seeing a lot of progress for this client. Now, that second article I wanted to talk about is evaluation of graduated exposure procedure to teach extended mask wearing in various settings to children with autism. So this article was published in the journal Behavior Modification in 2021 by Ertel et al. So this study used graduated exposure to increase compliance and duration of mask wearing as it became necessary, of course, in the peak of the COVID pandemic. So while the last study really focused on changing what this behavior looked like over time, going from just like having the food present to touching it and ultimately eating some of it, This hierarchy focuses on changing the duration of engaging in the same behavior, which is wearing the face mask. So they used a 15-step hierarchy, which started with just placing the face mask on the client's face, followed by wearing it for 10 seconds, and gradually increasing to wearing it for an hour. So they had 3 participants in this study, ranging from 4 to 9 years old, all with a diagnosis of autism and a parent report of non-compliance to wearing a mask. They conducted the session in an early intervention clinic and also did probes in the client's home and a mock doctor's office. So, compliance with each step was reinforced with verbal praise and a break at the end of the duration with a preferred item. So instead of moving up and down along the hierarchy just based off of that session's behavior, like we would do for feeding therapy, and like that last article did, these researchers conducted an assessment probe after 3 consecutive steps were mastered. Then the client was moved either ahead or to a previous step or just stayed where they were based on that probe. So this allowed them to skip steps if they didn't need to settle on one of those steps. And they were able to skip steps because it was the same behavior, just focusing on different durations. So that allowed them to kind of move through it a little bit more effectively than teaching every single step. And of course, if the client was struggling, they were able to move back a step. They were also would move them back if they had 5 consecutive sessions with noncompliance. Now, all participants made substantial progress of being able to wear their mask for over an hour in different environments, and that also maintained for at least a month when maintenance probes were conducted. And of course, it could be longer than a month as well, but that's just when they went back and did that maintenance check. So, again, very successful use of graduated exposure for a completely different task of mask wearing. So, graduated exposure and desensitization, as you can see, it has such widespread uses in our therapy sessions and also in everyday life. So, this is a very effective antecedent intervention that we should all be familiar with. So, I'm going to be including a freebie with today's podcast, which is a worksheet to help you establish the hierarchy to use in graduated exposure to assist you in using this method with your clients or with yourself or really anybody else that can benefit from reducing some non functional anxiety or fear responses that they might be having. So, thank you so much for joining me today. Be sure to join me next week as we are going to be talking about antecedent interventions for automatically reinforced challenging behaviors. And remember, if you are not already a member of the Behavior Crew, head on over to abcbehaviortx.com, sign up right now so you can get some of those free CEUs because as you're listening, you might as well get CEUs for it, right? Well, thank you for joining me, and I will see you next week.